Informed consent for tooth extraction. Introduction. While dentists always try to save your natural teeth, there are situations where extraction is the best solution to protect your overall oral health. Tooth extraction can eliminate pain, prevent the spread of infection, and improve your smile. Why? Your dentist might recommend removing a tooth for several reasons. Here are the most common ones. Severe decay and trauma. Sometimes a cavity or fracture goes too deep, reaching the sensitive inner part of your tooth called the pulp. This can cause pain and an infection that might spread. Problematic wisdom teeth. Wisdom teeth are those last molars in the back of your mouth. Often there isn't enough room for them, and they can grow in crooked or never fully come in. Food and bacteria can get trapped around the area. This can cause pain, damage other teeth, or lead to infection. Advanced gum disease. When gum disease gets very severe, it can damage the bone supporting your teeth. Sometimes a tooth becomes too loose and extraction is needed. Orthodontic reasons. If you're getting braces or other orthodontic treatment, removing a tooth or two can create the space your dentist needs to straighten your smile. Risks of tooth extraction. Like any procedure, tooth extraction has some potential risks. It's important to understand these, but remember, serious complications are very rare. Pain and swelling. These are common after an extraction, but usually manageable with over-the-counter or prescribed medication. Bleeding. You might have some bleeding right after the procedure. You are at increased risk if you are on blood thinners. If you are taking warfarin, it is important to check INR before the procedure. Infection and dry socket. Sometimes the healing process doesn't go as expected. This can lead to infection or a condition called dry socket, where the blood clot dislodges, causing pain. You are at higher risk of infection if you are taking bisphosphonates. Tooth fracture. In some cases, a small piece of the root might break off during removal. Your dentist might decide to leave it if it's unlikely to cause issues. They'll monitor the situation, and sometimes these fragments either work their way out or can be easily removed later if needed, damage to nearby teeth. While uncommon, there's a slight risk of damage to a neighboring tooth or filling. Your dentist will examine carefully and inform you if this occurs. Sinus issues. This is mostly a concern with upper back teeth removal. Sometimes a temporary opening can form between the extraction site and your sinus. This usually heals on its own. Avoid blowing your nose forcefully for a while, as this can hinder healing. Nerve changes. Rarely, you might experience some temporary numbness or tingling in your lip, tongue, or chin. This is often due to a nerve getting bruised during the procedure. In extremely rare cases, these changes might be permanent. Understanding the alternatives. Observation and management. Sometimes we might choose to closely monitor a tooth that's causing concern. This could involve treating symptoms like pain or infection with medication. It's important to understand that this option could lead to the eventual need for extraction if the problem worsens. Root canal treatment. If the inner part of your tooth is infected, but the tooth itself is structurally sound, a root canal procedure can clean out the infection and save the tooth. Your dentist can help you determine if you're a good candidate for this treatment. Advantages and disadvantages. Advantages: quick and easier. Extraction can be a simpler and faster solution than a complex root canal procedure. Removing the source of the problem offers significant relief and ensures the pain won't return. Disadvantage: loss of natural tooth. Even with modern replacements, nothing is quite as good as a healthy natural tooth. Cost of replacement. If the tooth needs to be replaced, options like implants, dentures, or bridges can be an additional expense. Tooth extraction procedure. Here's what you can expect during a treatment. Prior to your appointment, if you're being treated under local anesthetic or intravenous sedation, you should eat a light meal. If you're being treated under general anesthetic, you should not eat for 6 hours before your appointment. Continue to take any prescribed medications unless you've been advised not to. X-rays. Your dentist will take an X-ray to confirm the plan and ensure the best approach for your specific issue. Numbing. First, we'll numb the area around the tooth so you won't feel any pain. You'll still feel pressure and might hear some sounds during the procedure, but it shouldn't hurt. If anything feels uncomfortable, just let your dentist know right away. Removing the tooth. The dentist will carefully loosen the tooth and then gently remove it from its socket. Sometimes, for an easier extraction, the tooth might be divided before removal. These are all normal steps that allow for faster healing. After the extraction, your dentist will clean the area and might place a few stitches to help it close up and heal properly. The stitches dissolve on their own, so there's no need to worry about them. Recovering from a tooth extraction usually takes a few days. By following these instructions, you'll help the area heal properly and avoid any problems. 1. Manage bleeding. It's normal to have some slight bleeding for the first day. Biting on gauze as instructed by your dentist will help. If bleeding persists, replace the gauze and bite firmly for another 15 minutes. If you can't control the bleeding, please contact us. It usually takes up 1 to 2 weeks for the gums to heal, 2 months for the bone to heal, and up to 6 months for bone remodeling to complete. 2. Reduce pain and swelling. Expect some discomfort. Pain and swelling are normal and tend to increase slightly over the first few days. Take medication. Follow your dentist's instructions for any prescribed pain relief. Over-the-counter pain relievers like ibuprofen can also help. Ice it. Apply an ice pack to your cheek near the extraction site for the first 2 days. Use it for 10 minutes on, then 10 minutes off. This helps reduce swelling significantly. 3. Keep it clean. Gentle rinsing. Don't rinse for the first day. After 24 hours, gently rinse with warm salt water, 1/2 teaspoon salt in a cup of water. After meals and before bed, careful brushing. Brush gently, but avoid brushing directly on the extraction site. 4. Avoid things that slow healing. No smoking or alcohol. These interfere with the healing process, so avoid them for at least 48 hours. 5. Eat soft, cool foods. Stick to soft foods and liquids for the first few days. Think mashed potatoes, smoothies, yogurt, etc. Avoid hot foods and drinks, which can irritate the area. No straws. Sucking can dislodge the healing clot. 6. Plenty of rest. Take it easy for at least a day or two. Avoid strenuous activity, as this can increase bleeding.